Hi, good afternoon, everyone. This is Drew Preston with the Nebraska Medicaid program, here to provide an overview of Heritage Health Adult, Nebraska's Medicaid expansion program. We'll spend our time today looking back to the last 2 months of the program, giving a little bit of an update of how many Nebraskans have been found eligible. And then we'll look ahead to the next steps in the program as we look to build onto the program even further. So to start us off here today, some enrollment numbers, how many Nebraskans have been found eligible for the program so far. So as of the beginning of December, we've already found 22,000 Nebraskans eligible for coverage. So the program is off to a great start. This chart has it broken down specifically in the month of November, how many folks we found eligible, and then adding it all up, all in total. So as you can see, and as many of you may already be aware, Nebraska's Medicaid expansion program is a little bit unique in that it has two benefit tiers, basic benefits and prime benefits. So this chart delineates out the total of how many Nebraskans have been found eligible for basic benefits through Heritage Health Adult and how many have been found eligible for prime benefits to this point. So as you can see here, right now we're looking at, roughly speaking, about 2/3 of folks with basic benefits, about 1/3 with prime. And then prime, there's a handful of different ways that you can find yourself with prime benefits at the moment, certain circumstances. And so this table breaks that down even further than that. But what we'll really spend most of the rest of our time here today focusing on is starting next year, all those people that you see on this chart here who do have basic benefits at the moment will be able to earn prime benefits through some features that we're adding to the program. So we'll spend a little bit of time talking about that over the rest of this presentation here. So like I already kind of alluded to, a couple of big updates for the program that happened in October. So a little bit over a month now at this point. Of course, benefits through Medicaid expansion through Heritage Health Adult began on October 1st. The other big piece of news about the Medicaid expansion program in October was that the federal government approved Nebraska's Section 1115 demonstration waiver. That happened on October 20th. Generally speaking, what these waivers do are allow states to add new features, innovative features to their Medicaid programs that aren't conventionally part of state Medicaid programs. These are features that are, per standard Medicaid laws, aren't generally part of Medicaid. So what these waivers do is states have to apply to the federal government to add a specific new feature to their program, and the federal government approves that new feature via this waiver. So these waivers are used for different purposes for Medicaid programs all over the country. And Nebraska is using one to further build on to our Medicaid expansion program. So internally, what we're referring to this as is kind of phase 2 of Heritage Health Adult. But really, the other way of thinking about it is that it's just the next steps in building on to the Medicaid expansion program. So to introduce phase 2 of Heritage Health Adult, if you will. So like I said, we'll start this timeline back in October of this year, of October 2020, when benefits through Heritage Health Adult began. The next major period that we're looking forward to is April of 2021, when wellness and personal responsibility activities will be added to the Heritage Health Adult program. And then after that, a year ahead of that point in time, in April of 2022, that is when community engagement activities will begin as part of the Heritage Health Adult program. These three groups of activities, the wellness, personal responsibility, and community engagement activities, these are the three new features that Nebraska's Section 1115 demonstration waiver is adding to the Medicaid expansion program. So just to kind of reiterate that point, the wellness and personal responsibility activities are the main part of the demonstration waiver that we're focusing on as part of phase 2 of Heritage Health Adults. What these points will do, or what these activities will do, I should say, is they will allow people in Heritage Health Adult who have basic benefits to qualify for prime benefits. So that, roughly 2/3 of the folks that you saw on that chart on the very first slide, they can choose to complete these activities beginning in April of next year. And by completing these activities, they will qualify for prime benefits. However, it's worth noting that not everyone in Heritage Health Adult will have this waiver applied to them. So those groups that you saw on that chart at the beginning of the presentation who already have prime benefits, they will, in essence, continue to receive prime benefits in the same way that they are today, and the waiver, in essence, will not apply to them. So, like I said, just to reiterate one more time, these activities will begin on April 1st of 2021. And then phase 3, we're not really going to spend much time talking about that today, just because it's a little bit further off in the future. And we'll be sure to share with folks more information about that phase when it is sooner. But phase 3 will include adding the community engagement activities to the Heritage Health Adult Program. The community engagement activities are also part of the demonstration waiver, but will not be added until a later point in time. So for most of the remainder of our time today, we're going to look a little bit more closely at the wellness and personal responsibility activities, and then break those out into even further detail. So we'll focus on the wellness activities. That's the first group of activities under the demonstration waiver. Underneath wellness activities are two components, two parts to this aspect of the waiver. So to qualify for prime benefits under wellness activities, people who have Heritage Health Adult basic benefits will, one, need to complete a health risk screening with their health plan or their managed care plan, a couple of different ways to refer to the health plan. And the other of the wellness activities is completing an annual health visit with their primary care provider or a similar type of provider. So let's look at those two activities in just a little bit more detail. First, we'll look at the health risk screening, talk a little bit about what this means and who's responsible for completing it and making sure it's been done. So a health risk screening is a series of 18 questions that helps gather the health plans' members' health information. So to put that a little bit simpler, this is think of it as a questionnaire that's administered or provided by the health plan to their members. So this survey will be administered to everyone who will be in the demonstration program at the start of phase 2. And then it'll also be completed annually thereafter, because the health plans do want to make sure that the health information that's gathered on that health risk screening is up to date. So it will be completed on an annual basis. Like I said, the health plan, the managed care plan or managed care organization, they will be responsible for providing that health risk screening. And then the health plan will be letting the department know that they've completed that health risk screening for that particular member. Up next, a little bit more information about the annual health visit. So an annual health visit is a visit with a healthcare provider for a comprehensive evaluation and examination. So this will be completed. This will be, you think of it as a doctor's visit with between the primary care provider or specialist and their patient. By specialist, we mean that, some folks have certain health conditions that they may go see a specialist with some regularity. A good example of that would be if someone has a heart condition, they may go see their cardiologist fairly routinely. Maybe someone who has diabetes may go see an endocrinologist fairly frequently as well. So this will be another of the wellness activities. We want to make sure that people are seeing their doctor, at least on an annual basis. So the doctor can have perform an evaluation, examination of their health, their patient's health, to make sure that we everyone's on the same page about that member's health and make sure all their health needs are being addressed and taken care of. We will be providing a little bit of a head start for this if people in the Heritage Health Adult want to complete an annual health visit in February or March of next year of 2021. That will count as completing your annual health visit for the following year of the demonstration program, which is April 1st of 21 to March 31st of 22. Next, we'll spend a little bit of time digging a little bit deeper into the personal responsibility activities. Just like the wellness activities, there are two parts of the personal responsibility activities, two kind of distinct activities there. The first of these is not missing appointments with providers. And the second part is maintaining employer-sponsored health coverage. So let's take a closer look at both of these. For missed appointments, we ask that our Medicaid members keep their scheduled health appointments or give their healthcare providers adequate notice that they won't be able to keep their appointment. So, in this particular point here, if you know a week and a half ahead of time that you're not going to be able to keep your doctor's appointment next week, simply call ahead, ask to reschedule. That wouldn't be counted as a missed appointment. So for people in Heritage Health adults with basic benefits who are making an effort to qualify for prime benefits, members cannot miss 3 or more scheduled appointments within a 6-month period without good cause. And at the end of this presentation, we'll spend a little bit more time talking about what these good causes might be. We are not, and by we, meaning the department, are not trying to set policy for the providers as far as what counts as missed appointments or what is adequate notice. So providers will have the ability to use their discretion on how much time ahead of time do their patients need to let them know about to reschedule or cancel an appointment. Providers will have the ability to notify the health plan, that Medicaid member's health plan, if they choose to as well. And in order to do that, the provider will be submitting a $0 claim with with these specific CPT codes to notify the health plan, and in that respect, notify DHHS that their patient, in essence, didn't keep their appointment. And finally, the last of these activities we'll be talking about today is maintaining employer-sponsored coverage. What we mean by this is that when a Medicaid member in health who has basic benefits trying to qualify for prime benefits, as soon as they begin with the demonstration program and starting to complete these activities, if they have affordable employer-sponsored health coverage at the time that they begin the demonstration program, and we're asking them to keep that as a condition of qualifying for prime benefits. If a member does not have employer-sponsored coverage, this doesn't really apply to them. It's really only when a Medicaid member is beginning the demonstration and then also does have employer-sponsored coverage at that same point in time. So in a case like this, how it would most frequently look is that the employer-sponsored coverage would remain primary coverage for that individual, And then Medicaid would be the secondary coverage, maybe provide wraparound services, however it might look like with a particular employer-sponsored health coverage that individual has. And finally, a few words on good cause, just to explain that concept a little bit more closely. There will be some room, some flexibility if a Medicaid member trying to qualify for prime benefits doesn't complete a wellness or personal responsibility activity. We're commonly referring to these as good cause or good cause reasons. Some common examples might be, and I'll speak to these in reference of keeping your health appointments, just to kind of frame it simply. But if you're leaving to or preparing to head to your doctor's appointment, and there's some sort of health emergency, maybe you have a transportation issue, your vehicle breaks down, and you're not able to get to your doctor's appointment. Maybe a family emergency of some sort. If things like this happen and that causes that Medicaid member to not keep their appointment, that missing that appointment will not be held against them. So if members have questions about this, or they think they want to let us know about a good reason that they missed their appointment, they can contact either their health plan or the department to let us know that this is the reason I wasn't able to keep that appointment. And thank you very much for your time and attention today. We really appreciate your interest in Nebraska's Medicaid expansion and hope you have a great rest of your day.